We just heard from San Francisco Mayor Breed about how important it is to rely on experts, and we have two of them with us here today for our next session in discussing how to prevent the next pandemic. Dr. Brilliant is an epidemiologist well known for his work with the World Health Organization in eradicating smallpox. He is CEO of Pan Defense Advisory and chair of the advisory committee Ending Pandemics. Dr. Wen is an emergency physician and visiting professor at George Washington University Milken School of Public Health. She has also served as health commissioner for the city of Baltimore. Welcome to both of you, and thank you for being with us here today. Dr. Brilliant, I want to start with you. We are currently in an unprecedented situation where countries around the world are under social lockdown. Businesses are closed, schools are closed. But this doesn't entirely surprise you, does it? Because you have countless times warned us that this could happen. Why are we so unprepared against invisible viruses and pathogens?
Well, thank you very much, Allison. I'd like to say how much I enjoy sharing the split screen with Dr. Wen. If I could just say, listening to Tony Fauci, who is a national treasure, he has just delivered a clinic on the question of when do you shut down, when do you partially shut down, and when do you open up. What he has just spoken about should be played in every medical school, in every boardroom, every governor's office, and all throughout the White House. It's a terrific description of the issues. If I could compare it a little bit to smallpox eradication, and they're not comparable. Different virus, and we had different tools. We had vaccination, and we didn't need tests because you could see on the face of any child who had the disease or in the morgues the number of deaths. But there is a little bit of a difference between the idea of mass vaccination, which brings down the speed of the virus, increases herd immunity, and then prepares you for what Dr. Fauci said was the next phase, where much of a country could be opened up because they've got herd immunity. But instead, what you do is you then find every single case, do complete contact tracing. In the case of smallpox, you then draw a circle around them, a ring of immunity. We don't have a vaccine, but using testing, we can find every case, and then we can draw a ring of absolute quarantine around every one of those cases and contacts. This is not the laissez-faire Swiss cheese kind of social distancing that we've talked about. They're not comparable, but they are illustrative of what we face before we can open up parts of the country. We have to have sufficient testing, contact tracing, and then real quarantine to protect us. Then the rest of the world that we have can begin to get normal again.
Dr. Wen, you've had experience in our nation's public health system as health commissioner of a major metropolitan city. So I'd like to bring in some questions. We got hundreds of them from our readers to ask both of you. And I wanted to bring in one from Jitendra here in the US. How can we improve our public health and security infrastructure? Should there be a separate federal agency for health security? Would love to get your thoughts on that.
Well, I very much appreciate the question, and it actually brings up, and Dr. Brilliant's answer also brings up there's a saying in public health that public health saved your life today. You just don't know it. That so much of the work of public health is invisible by definition. I mean, we're successful when we can prevent these outbreaks. We are successful when we can, as Dr. Brilliant said, put a ring around these infections and prevent them from spreading. We're successful when we can remediate housing and prevent that child from being lead poisoned. The problem, though, is that when public health is invisible, we become the first item on the chopping block. And when you look at local public health and what's happened in recent years, I mean, we've lost tens of thousands of local public health workers. We have had just this years long of disinvestment in local public health infrastructure. And all of that is becoming very obvious in the case of the COVID-19 pandemic. And so I don't think what we need is to have new infrastructure being put up, to the viewer's question, but rather what we need is to have investment in public health and to really put the face on public health, to make public health visible. Public health needs to be at the table for every decision, because ultimately fighting for the public's health is about health and well-being, and it's also about economic security and about national security.
And this is a point that both of you have made, but as we talk about how we prepare ourselves to prevent the next pandemic, it always seems that when an outbreak occurs, we go in crisis mode. There's a lot of attention, there's a lot of political leadership focused on it, there's a lot of funding. And then when the cases wane, as they inevitably do, all of that disappears. So we have a question from Marcia here in the United States about, after this crisis wanes, how can we sustain the will to change public health for the better and be more prepared and ensure that we have more equal access for future crises?
Do you want to answer that, or would you like me to? Dr. Wen?
You can.
I think that's a question either one of you should pick up.
Well, I'll give it a try then. Echoing what Dr. Wen said, another thing we say about public health is that public health is about nothing, because we succeed when nothing happens. But how much would you pay to have no fires happen, no burglaries happen? That's what public health does. It's so that no epidemics or pandemics happen. So taking a step from what Marcia's question was, in order for us to be able to do our job so that nothing happens, I'd like to say nothing bad happens, we need to reinvestigate, reinstill, and refund the public health infrastructure, not just in the United States, but if we're talking about pandemics, because they begin anywhere in the world, we need to support the World Health Organization full bore. We need to look at the countries that are failed states or that have insufficient healthcare systems and exist in what we call hotspots, the places in Africa from which bloodborne diseases have historically arisen, like Ebola, the places in South Asia where historically respiratory diseases like Asian flu and bird flu have arisen, and now SARS, and the places in South India, South Asia, where cholera and other foodborne diseases have occurred. We need to support those healthcare systems, and there are organizations like CORDS, which connects regional disease surveillance, many of the WHO, FAO, OIE, which is the World Health Organization for animals, that we should be supporting. This is not a time for us to think that we can stop this disease only in San Francisco or New York or at the shores of America. We have to be good citizens on a global basis.
And I would add, too, that in addition to the global work that we have to do, understanding that diseases know no boundaries, there's also a lot that we have to do within the U.S. as well. If it's anything that this pandemic has taught us, other than what happens when we do not invest in public health, it's also unmasking so many underlying health disparities and what happens with the history of racial discrimination and racial inequities that are present in our healthcare system too, in our overall systems. And so while we address these acute issues and stop deaths and stop infections, we also have to be turning to these chronic conditions, these chronic issues related to social determinants of health and longstanding disparities that we must correct also.
And as we look ahead for what changes might need to be put into place in order to adjust to the new normal, as we come out of this pandemic, we have a question from Edward in Spain who asks, how will the world change, or will it all be the same in 3 or 4 years? I'd like to ask both Dr. Wen and Dr. Brilliant about what you envision will be different about our lives. Will it be normal, or will it be a new normal?
I mean, I do think that in the short term, we will continue to see many changes in our daily lives. And I want to acknowledge the huge sacrifices that everyone has had to make, whether it's individuals, kids who are not going to school and the impact on their parents and the impact on so many who have lost their jobs and have had to really make huge sacrifices for the betterment of society. I think we'll continue to see a lot of changes related to how we interact with our world. There'll be changes to our workplaces, changes to our schools in the short term. And I think that longer term, the hope that I find is that we'll see why investing in public health is important. We'll see why the voice of science and health needs to be at the forefront with voices like Dr. Fauci's and Dr. Brilliant's. And I also hope we'll see just how interconnected we all are and how our futures are tied to one another. And our resilience in this time is one that gives me inspiration and hope, but also is the path forward for our country and our world.
And if I could add to that, I would say what would give me hope, and this is hard for people to hear, but it's a good thing. I would like to see a 3-year plan or a 5-year plan at the national level and at the global level. And it doesn't mean I don't think that we will be we wouldn't be loving or going to the store or going to sports for 3 years or 5 years. But we have to be realistic. When Dr. Fauci says it's 12 to 18 months until we get a vaccine, that doesn't mean in 12 to 18 months there's rainbows and unicorns. What you get after 12 to 18 months of getting a vaccine is you get a vaccination program. So I draw comfort from the polio eradication program, from the smallpox eradication program, that even after you came down almost to 0 cases in both of those instances, in the case of polio, they extend that period of observation and surveillance by 3 years to be sure they didn't miss anything and the virus could come back. In smallpox, we waited 2 years, going house to house, every house in the world, to find any hidden cases for 2 years after the last case. We're going to need something not maybe as extensive as that, but we're going to need something similar to that. And the sooner we start looking at the holistic, reasonable time frame that we are going to be dealing with this virus, not in the way we're dealing it now. I don't mean lockdown. I don't mean the loss of the economy. I don't mean that joblessness. But if we don't plan for 3 to 5 years, we will be giving ourselves a false target. And if I've learned one thing about epidemics, they are not date-driven. They are event-driven. And we need to be very careful about how we do date-driven mandates.
Dr. Brilliant, I want to just pick up on that point and ask you about some of the lessons that you learned from your extensive experience with smallpox eradication. Do you see those lessons being applied in our response to COVID-19? And if not, why not? And how can we ensure that we have learned from our previous experiences with past outbreaks?
Well, I think in some ways, all of public health has learned from smallpox eradication and polio and everything that's come before us. So we are an iterative and aggregative field for sure. But there are some very big differences. In smallpox in India, with 150,000 search workers, enumerators, or contact tracers, 150,000, the largest peacetime army that the UN had at that time, we went door to door and made 2 billion house calls and found every person who had not been vaccinated, or in this case, was not quarantined. And we applied the then prevalent measure, vaccination, now quarantine, until we have a vaccination. I don't think that we are understanding what it will take as a nation, all 50 states, working with the federal government to do the kind of contact tracing, follow-up testing, and containment that we will need. That word that Dr. Fauci used is a word we used in the smallpox program. Surveillance and containment, finding cases and containing them. That cadence, I think we need to learn better. But the most important lesson from smallpox eradication, and the title of our session today is Hope. What gives me hope and makes it impossible for me to be a pessimist is that I saw the last case of killer smallpox in nature. And when that little girl, Rahima Banu, when the scabs fell off of her and they died in the hot sun of Bangladesh, that was the end of a chain of transmission going back 10,000 years of a disease which killed billions of people, 2.5 million during our summer of love, 500 million, 500 million in the 20th century. When those scabs fell and they were cooked by the sun, that was it. That was the end of one of the worst diseases in human history. That's the lesson that I want us to take. We can do that. We did it in smallpox with people of all colors and races and religion coming together in a global effort, all of us against the virus. That's what we need now, and I am optimistic that we can do it.
And it will definitely take a very strong, as Dr. Wen argued, public health force to do that and health system to do that. Dr. Wen, you very, very recently gave birth, so congratulations. You documented your delivery, and did being a patient give you a different perspective on ways that we can further strengthen our healthcare system against the next public health threat?
So thank you, Alice, for mentioning this. I have a daughter who is now almost 3 weeks old. She'll be 3 weeks old tomorrow. And I gave birth at the same hospital that I gave birth 2.5 years ago to my son. And it was a completely different experience, very different in how I approached pregnancy and delivery. I mean, whoever thinks about planning for giving birth in the middle of a pandemic, there were guidelines that changed seemingly from week to week. And I was worried until the last minute that perhaps my husband would not be able to be with me in the delivery room. It turned out that he was. But there were so many patients in our hospital and hospitals around the country and the world that now cannot have someone with them in this incredibly vulnerable time, whether it's pregnancy or having surgery or being a patient with COVID-19. And it just makes us realize that healthcare continues to happen in the middle of a pandemic, that it's not only the patients with COVID who are affected, it's really all of us who may have a health condition, may need to go see our doctor. And to your point about how it changes the perspective as a patient, I mean, I worried so much about my healthcare providers. I was worried about them and I was worried for them. There was a doctor and a nurse in the OB unit who had just been diagnosed with COVID. And a number of other doctors and nurses were out because they were out for exposure reasons. And I also didn't know whether my doctor and my nurse and the techs had COVID-19. And at the same time, I was worried for them. They were being issued one mask that had to last them the entire week. And I could see the mask already fraying after a few days of wear. And I worried that they could be contracting the disease. I worried about what their families are going through. And frankly, I worried about me and the other patients who were there. And I think these are just the new concerns that are present in the doctor-patient, provider-patient relationship that we might not have considered. And I think part of this new normal and the uncertainty that all of us are living with during these times.
And I wanted to ask you then, as you see the U.S. response to this pandemic, and as we look ahead at what we can do to prepare ourselves for the next one, are you optimistic that we have structures in place, that we have some lessons to learn from this response that will make our next response to the next outbreak better? And that's for both Dr. Wen and...
I hope that... Alice, I mean, I hope so. I hope that we will not be complacent afterwards. I hope that we will look at the lessons. We will look at the importance, for example, of widespread testing, of implementing these aggressive social distancing measures, of having contact tracing, as Dr. Brilliant mentioned, and having this army of public health workers who can do the important work that's needed to contain this illness. I hope that we will look at these long-standing disparities and now have the impetus to address them. I just hope that we'll continue to push forward with urgency and action, even after the immediate crisis is resolved, and that we will not move on to the next shiny object and forget how much suffering people have gone through and how many preventable deaths there were during this pandemic.
Dr. Brilliant?
I'm optimistic that we can. I'm concerned that we won't. And as our parents taught us, a stitch in time saves 9. We're seeing that a stitch in time saves trillions of dollars, and it will be millions of cases and hundreds of thousands, if not millions of lives. But we forget. History is replete with us forgetting. I think we have to behave as if we know that there is another pandemic coming, and one after that, like airplanes circling the old LaGuardia looking for a place to land. And that's not pessimistic. That's because science tells us that every year, 1 to 3 novel viruses leaps from animals to humans because of modernity, because we clear-cut the forest, because animals and humans live in each other's world now closer than ever, because we eat more meat, and especially in some places, more bush meat, because we can travel quickly around the world, as Dr. Fauci said, and carry that novel virus everywhere. So the facts are pretty clear. 1 to 3 new novel viruses jump from animals to humans every year. Now I ask, is our response proportionate to the risk of facing another disease like this 5, 10 times in the next decade? What about in the next 20 years in our children's life? Surely we've learned the lesson this time, which is why I'm optimistic that we can, that we will put the resources, train the people, arrange the institutions. So the next time we won't have, as we have in this case in the United States, a 6 to 8 week head start given to the virus, that we will think in 5-year plans or 3-year plans or 1-year plans and prepare ourselves for it, what is inevitable, but need not be catastrophic or as awful as this if we plan for it.
Thank you, Dr. Brilliant. Thank you, Dr. Wen, for sharing your expertise on this public health crisis and for giving us hope about ways that we can find to navigate this pandemic and the next one.